Good morning, Catina. Welcome to St. Louis Press Club's Hour in the Now series. Today is August 1st, and we are 3 years and a couple of months down the road from the first time you met with us. So thank you for agreeing to do this, especially you met at that time. We were meeting with folks as on the upswing of COVID hitting our community, hitting the world. So these were some times, and we were so grateful for your interview. And anyway, please introduce yourself, your title, and then we'll get going with this conversation.
Sure. Well, thank you for having me back. I'm Catina O'Leary. I'm the president and CEO at Health Literacy Media. And for folks who didn't see the interview previously, Health Literacy Media is a nonprofit health communications company. We focus on health literacy, and we sit here in St. Louis, but work all over the world.
Wonderful. For those who didn't see the first recording, and just in general, can you briefly describe what health literacy is?
Sure. So health literacy is a concept that really focuses on how we communicate health information in such a way that people can understand what they need to do. And it's important to say that, individuals are at the center of health literacy. We all have to make decisions about our health and figure out where to go and what to do. In the case of a small health condition like a little cold or a virus, or something that's more complicated like a COVID diagnosis, or even a cancer diagnosis, or something that's much more complex. So we have to figure these things out in the midst of a really complex health system. So we have to figure out the public health requirements, where to go in the medical health system, health insurance. All of these rules are sort of stacked on top of each other. And so health literacy really gets at the components of an individual, what we need to know to be able to make decisions and act on our own health, but also what the system does to make it easier. So we need to think about how do we support healthcare providers, hospital systems, health insurance systems, pharmaceutical systems, all of these folks in making things easier for people. So we do lots of work with all the systems we mentioned, purposely to help them do a better job with communicating information to people. So we'll talk a lot, I'm sure, today about some of the work we've done during the COVID period to help community partners and big health systems communicate about COVID and rules to help folks make decisions. But one of the key factors is this is not just about people not understanding or literacy or education. It really is about the complexity of both the systems and the health information that people need to process and act on.
Yeah, there's a balance working with those partners, as I recall, certainly from talking to you last and observing since talking to you what's happening. So has your business model at all changed since July of 2020?
It's interesting. The model hasn't changed so much. We still do what we do. But in July of 2020, it was pretty scary because much of our work was focused on our pharmaceutical partners and a bunch of community partners who were in hospitals and systems that were interested in sort of prevention and more specific kinds of healthcare. And that work all stopped. So everybody sort of shut down much of their research and development. People didn't have new prevention efforts going on, and everybody sort of took a deep breath and held. They didn't know what was going to happen with resources. They didn't know what specifically at that point to do about COVID. And so there was, 6 or 8 months where we were really worried about how we would go on. But early in 2021, people got their feet under them again, and we started to do a lot of COVID-focused work. And so we worked with a lot of community partners on how to communicate about COVID, what messages people needed to hear. We started to work a lot on vaccination information, helping people understand particularly the risk. So there was a lot of misunderstanding, and still is, frankly, about the risk of the vaccination compared to the risk of COVID. So we tried to help people understand both the short and long-term risks and how they could navigate and make their own decisions about that. We also have a transplant education program. So we focus on helping people with end-stage kidney disease, figure out when to move from dialysis to the transplant list and get a kidney transplant. Very early on, for folks in specialized populations like that, the questions about COVID became a big deal. So should they go ahead and get their transplant, or should they wait until this passed? So we spent a lot of time making materials that were really focused like that. And so that became the better part of our work for about 2.5 years. And then now we're back to sort of the regular things we were working on before. So it was interesting. It changed the content and sort of the context of how we thought about things for a while.
Boy, thinking about a transplant patient wanting to get in and maybe not being able to get in for the surgery. Was that a huge factor?
Absolutely. So some of these folks, particularly in the early 2020 period, were even already scheduled for transplants, and they had living donors. And the question was on both sides of both the donor and the recipient. If we go into these hospitals where people are there with COVID, you can't even get through. If we remember, those were like war zones at that point. I mean, people were out in, the parking lots and, lined up in the hallways, and they didn't know, what was going to happen. People were dying differently than they are now, certainly at higher rates, and there was lots of confusion. So for folks who were immunocompromised and potentially going to be more immunocompromised because of their surgery, there was a real consideration of, is it okay to go ahead and even go in these spaces? So we really had to spend a lot of time understanding with the medical providers what makes sense. How do we get people in and out? How do we talk about this in a way that people can understand and make decisions and continue on? And, in that case, we were talking a lot about masking and what the best masks are and how to do this. This is well before the vaccines. So a whole different set of rules. How do you talk to adults about hand washing in a way that feels significant? How do you talk about the right kind of mask? How do you talk about where it's safe to go and not? The difference between my immune system and a baby's or my grandmother's. There are all of these pieces of information that were really hard for people to understand. They weren't clear, and sometimes they even felt a little conflicting. Why is it okay for somebody to go to work at the grocery store where they're going to run into all these people compared to why is it not okay for me to go into my office, for example? There were sort of these, all of these different considerations people had to have, and it took a lot of context for people to understand and evaluate risk in order to decide what would be acceptable in their life in the context of their own health.
Some folks don't want to look back on the COVID period, on this unbelievable thing, that was so fraught, certainly. And we appreciate that you are willing to do that, because you have learned a lot from that period. Would you care to discuss more at length what it is that came out of living through COVID as the head of a health literacy focused organization?
Sure. I think it's interesting that people don't want to talk about it and look back at it. And it's sort of, for me, fits a larger narrative of how uncomfortable we are at talking about hard things, and how we think if we just don't think about it, we can protect ourselves in some way, rather than learn from them. And so I'm really interested in the learning from them process. And so, we learned a lot. We're reminded of those basic public health principles. If we're washing our hands and protecting ourselves, that's really great. And it's really important for all kinds of viruses. It's fascinating to remember, once we all were home and we were paying attention to hand washing and masking, the rates of so many other infections and diseases plummeted, because we were doing basic public health safety standards. And not everybody, there are lots of folks that are really frustrated with public health right now and not giving it a lot of credit. But the number of lives that were saved with those basic universal precautions, I don't think can even be calculated. It was the right thing to put those messages in place. They're free. We should be doing them all the time. It makes all the sense in the world. So that's one thing, is we've sort of gone back to our roots of what's important and how do we protect ourselves in basic scenarios. We also are reminded about context. So often in medical care, we don't tell people why we're asking them to do things. We expect people to do what their doctor says, what the nurse says, what the health insurance company says, and we don't explain why. And then when people don't do what we've asked them to do, we sort of place the responsibility back on them. We say that they're non-compliant. They're unwilling to do what they're supposed to do. Sometimes there's even a statement that they're not very smart, or, there's all this stuff that's sort of wrapped into why people don't do what they do. But what we find is when you talk to people about why they do things and you explain to people why you want them to do something else, their reaction is very different. Once people understand and they have all the factors, most people don't want to do things to harm themselves. And that's a reminder from COVID as well. Most people are very smart. Most people are very good at taking care of the basic things they need to do to keep themselves alive. That's what we do as a species. So if you tell people the very clear information and help them understand the context, they behave differently. And I think we lose track of that a lot. And COVID has certainly reminded us. I think the other thing about COVID that is so interesting is how we're all connected. The things that we do have an impact on other people. And I think that lesson has not been learned yet. So we're looking at the people who are going everywhere without masks still. We're saying that COVID is over when it's in fact not over. And so the wastewater, other things are telling us a different story, but we're not testing at the same rate. So we're not seeing what's actually happening, but we're seeing people get sick. They're certainly not getting as sick generally and dying, because many people are vaccinated multiple times now. And so, their health is different than it was in the beginning when this was a new novel virus that nobody had any immunity to. But that doesn't mean it still isn't a really hard virus to handle. And so those same precautions that we should have been taking to begin with, are really important. So we're writing materials right now with partners all over the country. We have a collaborative project that's funded by the CDC with folks. It's led out of the University of Florida, but there are 6 or 7 other sites. And one of the materials we're working on right now is to really talk to people about all the other things masks are good for. Because we have to deal with the fact that everybody thinks COVID is over in communities, and everybody wants to believe that. It would feel really great to say we're behind it, we're past COVID, we don't have to worry, but that's not really true. They don't want to talk about COVID anymore. So if they don't believe it matters and they don't want to talk about it, then we have to come up with other ways to convince them. So we're talking about all the other reasons that masks are reasonable, why it's a good idea, why you might want to keep other people's germs out of your body, things like that. And it's just a really interesting time to think about how creative you have to be to help people think.
Absolutely. You talked about the historical context, and then you have already alluded or talked about the cultural context, how together we have come through this. Do you see anything different or exemplary in this region, in the St. Louis region, with regard to health literacy needs, maybe audiences?
So I do think that St. Louis, the region, is interesting in that we have so many communities here. We're a refugee and resettlement community, and so people come from all over the world intentionally. We're warm and welcoming, and there are many people here who have sort of intentionally advocated to bring even more communities here for a variety of reasons. And so, we have so many cultures and languages and so much diversity in our community, which from a health literacy perspective means that we have to think more clearly about how we communicate, make sure that everything that we do is available for people in their primary language, and not just creating things in English language and translating them, but also thinking about what the examples are, how we can make sure that the analogies and the stories we tell have been sort of customized for people's various experiences, because that's really a part of health education, is teaching people things using examples that they can identify with. Mm-hmm. And so if it's an example that is not relevant to them, or they don't understand or perceive, it's not a useful example. And so there's a lot of consideration for who the intended audience is and what they need to know. And we certainly have lots of audiences here. So we spend a lot of time testing materials. Our job is to go out with new messages to all of the audiences that we intend to get the message, and talk to them about how do they interpret the information that we think we're going to share. And we hear really interesting things often from folks. We think that we're so clear. It's sort of interesting from a health communication perspective. We're all using images and icons and graphics and all these things right now. But if we show folks in the intended community these same images and icons and graphics, and we ask them what they perceive, it's not often what or it's not always what we think it is. So that important piece of asking people, what does this mean to you? What does it tell you to do? Tell me what would be better to communicate this is really important. So that partnership with community is critical. And St. Louis is a great community to sort of test all of those things because, we really have so much life and diversity and culture here. We're very lucky, and I'm not sure that people understand how phenomenal that is in the context of the world that is much less diverse at times.
Well, I'm happy you just discussed two of my questions. One, the analytics, the evidence, testing what you're doing. That analysis is so important. So you have the funding, I see, to do the focus interviews so that you can do this continuum of continuous improvement, essentially. So that's important. You talked about graphics. I was going to ask you about the role of besides words, pictures, do you have any anecdotal information with regard to that?
So many. I mean, it's really interesting. We test these materials all over the world, and we test them with things that we create. We also test them with things that other people create. And I'll give you an example outside of COVID. But we did a set of focus groups recently for patients who live with lung cancer. So another partner had created materials for patients who needed to be screened for lung cancer and learn about sort of immunotherapies and targeted treatments and all these really complex medical tasks. So they create these in English and they want them to go to other populations. And so they ask us to test them with people whose preferred language is Spanish. And they want to test in certain cities. So one of them is in South Florida. So we go and we take these materials that they've created, and we're in a focus group in Miami with some Zoom, and we flash up this picture that's on one of the materials, and we say, what does this make you think of? And this is a lung cancer screening material. And one of the people in the group was like, oh, that's the guy in the HIV clinic. So the story is, many times when we create these materials, we use stock images, stock photos of professional actors that have, been paid to create these stock images. And very often agencies and other folks go look for a stock photo and they stop on the first or second page. And the first or second page often has really great images that are highly preferred, that have been selected a lot. So the computer sort of puts them toward the top. And everybody picks them because they're attractive people that look like you want to communicate, and they're often have the diversity you're looking for. But the problem is they get used for everything. So these people see this same guy in the same pose, in the same way for HIV and lung cancer and all of these things. And it sends such an interesting message of that's not real, that's not authentic, you don't understand my problem. And it probably also connects health conditions that aren't really connected in some people's minds. So one of the learnings that we're always trying to promote to our partners and friends is if you have to use stock images, as many people do, you might start, on page 10 or 12 of the images rather than starting at the beginning and picking something from page 1, because everybody does that and you sort of get the same images over and over. And so that's really important. But in that same group, they were also testing messages. So initially created for an audience in the US. Many of the folks in that primary audience of lung cancer that had started were white or Caucasian folks. And so the materials had a lot of pictures that overrepresented people who were white. And so they also wanted to talk to African-American audiences. So we're doing a little bit of all of that. And the language was really interesting too. So when we talked to people who identified as Black or African-American, they looked at both the materials, the English and Spanish as well. And some of them would say things like, well, it looks like, that these Spanish materials are only the translated versions of the English materials, and you haven't really done anything else but put them in Spanish. Doesn't that bother people? And the people who were primarily Spanish speakers did not bring that up. And so there's this really interesting thing with people from various cultures being worried about other people and having really this empathy and compassion to make sure that their peers have what they need, more so than people in the community caring to say. So the people in the Spanish community said it's real, or the Spanish speaking community said it's really great that you bothered to put these in Spanish. I really appreciate that. And when we asked them, we said some other people said the pictures don't look like you and some other things. And they were like, well, as long as you have a person who is generally not white and has sort of skin tones that are different, we presume that you're interested in diverse audiences, and that's okay. But if it's not in Spanish, we know you don't care about us. And so that really flags for me how low the expectations are of how much we care about them, right? Like their expectation is as long as it's in my language, I should be happy with that. Instead of, come on, let's do better. Let's create things that look like us and sound like us and reflect our communities. But the audiences really stand up for each other. And so the African-American audience were like, hey, wait a minute, that person doesn't represent and go with that language, or, come on, do better. So there's really a lot we can learn from communities in ways that are really unexpected. And I really appreciate that.
So has HLM, obviously you've stepped up to the needs of the culture, the times, the health field, but what are you doing internally to meet those needs?
Sure. So, I think that it's interesting because when this started, 3 years ago, we probably had half the staff size. So we've grown pretty significantly. And when we've grown, we've really thought about hiring people who tell stories. So we've hired some script writers, filmmaker type folks, a lot more design people, video, really thinking about sort of multimedia sources that reflect lots of audiences. We have a much bigger group of consultants who speak multiple languages. So we certainly have translators and actors that we can hire who are really great. But what we've learned from communities is sometimes actors are so perfect that it doesn't feel authentic. So we have all of these folks who speak various languages who are regular people, and we pay them as consultants to help us, look at scripts and make sure that they really reflect community voices, and then they voice those in videos and things like that. So it's really matches people in community, and it's not so perfect that it feels like an ad. Because that's important to community, is feeling like you're talking to friends. Thinking about how all the sources work really well. We've doubled the size of our internal paid staff, and it's really diverse. So we've looked for people from all different educational backgrounds, geographies, age, race, gender identity, folks that really can tell different stories and bring their whole self to work. And I find that that's really important when we're all sort of looking at things from a very broad perspective that represents the diversity that we all have. We all hold a bunch of diversity. Our materials and our questions get better. So that's one of the things that we spend a lot of time on internally, is thinking about who's here that has experience with this, either from themselves, their education, their family, their friend group. How do we talk about this in a way that is appropriate and reflective and really consistent with the intended audience experience? And we want to make sure that we're really reflective and we're aligned and we resonate with messages and materials and attitudes that can be understandable to people, so that when we try to influence them with these messages, we try to give them the health information that they need. They can understand it and take it seriously enough to sort of evaluate it in their own head and then make a decision in a context that they can follow through with. Does that make sense?
It makes great sense. The definitive you gave on that, thank you. Also, I'm sensing that with this greater latitude, you are also able to do nuanced messaging. Those nuances sometimes resonate so much with your various audiences. So it seems to me you have the capacity to do that.
It's really important. And, one of the other things that we've learned from COVID is, because we were all inside so much, social media and the way that people sort of communicated messages online really exploded. So social media was already something that people did for their free time. But with this, it became part of how people shared information about health and other things. And, there's a lot of discussion about information, misinformation, and disinformation. Mm-hmm. So we found that during COVID, a lot of the healthcare providers stopped using social media. And what they would say to us is, there's so much disinformation and so much sort of targeted sort of assault on people that are talking about COVID or vaccination or any of these issues, that if we post anything about it online anywhere, we get such a sort of a targeted just we get attacked. It's a targeted attack based on that. So they stopped posting anything, which meant that very often the only information people saw was information that was coming from friends and family that might or might not be true, as well as information that was intentionally untrue from sort of people that were purposely intending to provide disinformation or misinformation. And so we've really worked hard to sort of begin creating messages that people can use collaboratively, and sort of rebuild that infrastructure of information sharing. Because if we don't do that, the only information is coming from faulty sources. And one of the things we know from a health literacy perspective is for people with lower health literacy, they often get health information from sources like social media, rather than a healthcare provider or a more reliable source. And there's a lot of mistrust in healthcare providers for many reasons right now. And so it's important that those messages are there, and it's important that they've been validated and they have some authenticity. And so we're trying to sort of rebuild some of those systems because it sort of got diminished during this period of targeted misinformation and disinformation.
Can we find your materials?
Well, you can go online and look at us at healthliteracy.media. But our materials are also coming out through lots of partners. So you'll see lots of healthcare systems that are using social media and other materials that are ours. And I would just encourage folks to really, be sure to not pass by those health system messages. It's really important. They're not as exciting sometimes as the sort of juicy stories or whatever that we like or share, but they're really important to the public good that trusted health information is amplified. It's a really important thing, particularly for folks with lower health literacy, to see those messages coming through.
Seems to me, with a changing lexicon with regard to word use, that you would be a great help to journalists. Do you work at all with the journalism community?
We haven't had much opportunity to do that. And it's interesting because early on in HLM's history, that was a huge part of our work. So when the Missouri Foundation for Health initially funded us, part of what we did was help journalists all over the state of Missouri at that time place stories about health literacy. We wanted to create an understanding of health literacy in all of our communities here. And so there were thousands of stories that got posted with HLM's help. But we haven't had those requests very much lately, and we haven't had the resources to continue that network. And so I think that's a really important point, and I'll make myself a note to revisit that.
Yeah, courting, it's a constant courting of audiences, and journalists certainly are included in that, and would have great value in working with HLM. As well, the trust factor, of course, audiences have trust issues with journalism. This can only help.
Right.
So, please.
No, and I was just thinking in the context, we've spent a lot of time lately thinking about sort of AI and machine learning and all of these sort of pieces of new emerging technology. And I think that is another reason to revisit those relationships with journalists, because I feel like many of us are fighting the same battle.
Yes.
There are a lot of fantastic uses for artificial intelligence and machine learning and, deep language learning processes and all of these things. But there are also some very serious misuses and sort of misunderstandings. And when we start to replace all the journalists and writers with machines, we need to think really clearly about what that means. And we've spent a lot of time lately thinking about this because we do a lot of work with rare disease. So, there's not a machine strong enough to predict the thing that hasn't happened to humans correctly. So if you're a person that's on a, cancer trial for a rare cancer that's never been treated, we don't know what's going to happen to you until you've actually gone through that experience. You can't predict that. For example, there are many things that are unpredictable because we just don't have the data from previous studies, and the algorithms can't create that. I guess they can create it, but when they create it, they're just guessing like everybody else. And so how much data is allowed to impute? How much are we allowed to sort of cheat to estimate and project a thing that hasn't happened yet? And I think the journalists, health writers, folks like us are really important to remind people, that there's an amount of humanness that's required, an amount of critical thinking about how do we feel about things, how do we as humans respond, and what happens to our bodies when the unknown sort of is part of the intervention. And so I feel like that's a really good conversation to have as well.
It's obvious you're having that conversation internally right now.
We're spending a lot of time thinking about, again, we don't want to be, naysayers or Debbie Downers. There are so many important uses. If you can have a computer aggregate a bunch of, data from multiple sources and find the most important information in a narrative from a health report or an EHR that's, hundreds and hundreds of pages. I mean, all of those things are so powerful and much more powerful than we can quickly do. But the human part of like, how do people feel about this and what's going to happen to us when we experience something that's different? How do we sort of navigate those conversations culturally, emotionally? That's a different thing. And we need to segment these things. When we talk about sort of generative AI and we're creating things from nothing, that's really part of the thing I'm concerned about. And I will give an example. We think that, it can sort of, call all of these data sources. And so recently I asked one of the chat GPT things to help me create an obituary for a friend. And it gave my friend half an obituary that was correct. So it got one of his degrees correct and a couple of other things. And it gave me a beautifully written obituary that assigned him some degrees he didn't have from Harvard, a wife and a couple kids, and all of these like sort of relationships and quotes from people who didn't exist. And the tricky part about that is it was gorgeous. I mean, it was so well written. It sounded like a human wrote it. It was much better than I write personally, but it wasn't true. And I wouldn't have known had I not known my friend so well. And so that's the part of the generative AI, the all of these AI models and all these questions is if you don't have the deep knowledge to evaluate the information, so many times we skip over things that are well written. And so, how much misinformation gets shared with the world because somebody doesn't have the knowledge to really research. And we've told them not to research because the computer's going to do it. And the computer's job is to fill in the blanks and give you a beautifully written story. That's a problem.
It's interesting from teacher's standpoint, instructor, I have the students on the syllabus. It says if you're going to use ChatGPT, whatever, generative technology, that you're responsible if the information is wrong.
Right.
And you get graded down.
Right. Absolutely.
So that's important. There has to be responsibility.
Right. And I was at a conference a couple of weeks ago, and one of the companies that's creating this generative AI process was speaking, and they went from the machines are going to do all the things you hate to do, which sounds great. So the machines are going to tabulate and do these things to, they're going to communicate with people, and, we'll use the robots and we'll do all these things, which starts to get a little bit scary. But I asked who validates the models? Who makes sure that these really match? Because that's what we do when we create things. We go back and say, does this resonate with you? Right. And the person looked at me and they said, what do you mean? So I explained, and they were like, oh, well, the bigger the models and the more data, the less necessary that is.
Ooh. Ooh.
Okay.
Yeah. Yeah. You want the students or whomever to embrace the technology. Right. But understand there's this responsibility.
Absolutely. We have to really think about the balance here and think about the uses. So, as people, we don't say that we can do everything. We say, this is my expertise. This is what I'm really good at. And this is what I'm interested in. And this is what I don't know at all. The technology at this point is sort of trying to gobble up the whole pie. And I think it's really important that we segment out really important use cases and we prioritize those, but we really continue to think about where the humans fit.
Is there anything you would like to talk about before we end this lovely conversation?
I think it's a fascinating time. I think it's a scary time, but such an interesting time that we live in right now. And I think, we have so many opportunities to really be thoughtful and do a better job of sort of shepherding each other, our planet, all of these things. And, many of us have lived in a time where there's a lot going on, but we've had so much privilege of, having access to food and water and electricity and cars. And, we haven't had to do the really hard work that some other generations and people in other places are. And I feel like we're on the cusp of really having to understand what hard is. And we need to sort of expand the way that we think about the world and our responsibility. And I feel like very often we have these little things that we think about. And so health is sort of this little bitty area that's often separated from other things, but it's very interconnected. And so I'm spending a lot of time here thinking about how we're all connected, how the way that we behave is connected to our world, what that means in terms of, the environment and sustainability and people, and even our sort of emotional connectedness and isolation, and how we treat each other and what that means for the way that we grow together. And I think it's much more complicated than we would like to believe. And I think it's important to think about.
Yeah, right now we're talking about environment even more than ever because of extremes and what it does to the psyche, what it does, of course, to your health. So we're living in times where I think people are now getting a little frightened about the futures. What is clear to me, Catina, is your public health background, the do-gooder community in that office at HLM. You're doing good, and we're lucky to be able to talk to you again, to hear your thoughts about health literacy, a very important topic, and it will continue to be. So thank you from the St. Louis Press Club for your time, and may we do it again.
Thank you so much. It was nice to speak with you.
Likewise. Thank you.